Hello everyone, this is Dr. Greg Pursley at PC Medical Centers in Cape Girardeau, Missouri, and today I'm going to talk about one of our favorite subjects from our patients, and that is arthritis. This right here is what's called a degenerative scale. It shows you textbook normal all the way down to phase 1, phase 2, phase 3 of degenerative arthritis. Now, here's a question for you. Most people have told us, or they think, that this is an aging process. As you get older, it goes this direction. But here's a question for you. Are all of the joints in your body the same age? Think about that. Have all the joints in your body been in your body the same amount of time? Well, the obvious answer to that is yes, they've all been in there the same amount of time. So the question is, if this is an aging process alone, then shouldn't all the joints degenerate at the same rate? The answer to that is yes again. So obviously the joints don't all degenerate at the same rate. Therefore, it's not just an aging process. It is an aging process combined with a functional process. So what do I mean by functional process? It means that if the joint is working properly and it is what we would consider textbook normal, which really is just a few things. It's the bones are nice and smooth across the front, the joints are really thick with a disc in between, and the nerves coming out are really thick and have plenty of space. That's what a textbook normal joint would look like. This is a low back example, by the way. If the joint stops functioning properly, which means it either had an accident or an injury or a repetitive motion problem that caused it to stop working properly, it will start to move into phase 1. Phase 1 is what we call a structural change. Structural means it's supposed to sit a certain way and be a certain way, but because of the damage that had occurred, the injury, the malfunctioning that occurred, it has started to structurally change. If it's structurally changing, it's not positioned the correct way, it will start to break down and create degenerative change. Degenerative change is when the bones start to become choppy and the discs begin to break down. The problem is that the nerve doesn't have as much space anymore. So the joint will move in this direction called the degenerative scale if it stops functioning properly. Eventually, if the function never improves, it will break down to phase 3, which is more of a surgical preventative approach. There's nothing we can do at this point. The nerve now doesn't have any space coming out, so therefore it starts to wither away and die. And so this is obviously something we want to prevent our patients from ever getting there. How do we do that? Well, we have a multidisciplinary, integrated medical clinic. What is that? It means that we have multiple different disciplines, multiple different practitioners working under the same roof to do, we have a nurse practitioner, we have a chiropractic physician, we have therapy, to do rehabilitation, manipulation, and injections for different things to improve the function of the body. So in that example, the degenerative arthritic change that happens over time because the joints aren't functioning properly, we utilize those treatment options to improve the function of the body so that it stops breaking down. Hey, look, it's simple. If everything in your body functions properly, then you don't have pain or symptoms. When pain or symptoms or degeneration develops, is because something is not functioning properly. Our job is to make sure it is restoring the function. So if you know somebody who has an issue like that, where their spine is becoming degenerative or they're in pain a lot, send them this video. We appreciate you doing that because we are gonna offer them something as far as a treatment option that nowhere else in the area is able to offer as a whole. A multidisciplinary integrated clinic. Like I said, my name's Dr. Greg Pursley with PC Medical Centers in Cape Girardeau, Missouri. If you would like to come in for a free consultation, click the link. We would definitely like to see you and see if we can help you out. If you know somebody we can help, you can send them this video. Hopefully it'll educate them on why degenerative change happens. Other than that, go watch our YouTube videos. We have lots of options, lots of information there. Or you can comment below and with any questions that you have, and we'll create a video for that. Have a great day, and we'll see you on the next video.